Take a look at these two sets of lungs. This set is pink and healthy. They represent the lungs of a healthy person. But this set doesn't look so great. They represent the lungs of someone who has smoked a pack of cigarettes, that's 20 cigarettes, every day for 20 years. Let's take a closer look at what's happening in the healthy lungs. They're being inflated with air, just like when we breathe. As they fill up with air, both lungs expand like they should and push oxygen into your bloodstream. We need oxygen for our body to work. When we breathe, air passes through our nose or mouth into our trachea or windpipe. In the trachea, air passes cilia. Those are tiny hairs that keep dirt and mucus out of the lungs. From the trachea, air passes into two large tubes. Each tube splits off into many smaller tubes. At the end of these smaller tubes is a cluster of tiny air sacs. There are over 600 million air sacs in our lungs. Imagine how small they must be. Each air sac is covered in small blood vessels that take the blood directly to your heart. The oxygenated blood goes directly to your heart, and your heart pumps it to all the cells in your body. Now, back to the smoker's lungs. These represent the lungs of someone who smoked for 20 years. These lungs are a blackish brown color because of the tar that comes from each cigarette. Tar is a sticky black substance that is created when some chemicals burn and melt together. The tar created by burning tobacco is similar to the tar that is used on roads. Tar in your lungs may lead to lung problems that can make it hard to breathe. Even though vaping doesn't force tar into your lungs, it does cause your lungs to get inflamed and clogged with blood, pus, and other fluids. The chemicals in cigarettes also cause lung cancer. If you look here, lung cancers have started to form. They start in the cells that line the surface of the lungs, like this white area. The lower portion of this lung doesn't inflate. That is what lung diseases like COPD and emphysema look like. People with these diseases find it hard to breathe, and they struggle with even the smallest, easiest activities like walking. Which set of lungs would you like working for you? The choice seems pretty clear.